everybody tonight. I feel so privileged to get to work with the whole crew here, and Ziv has been a brother to me, and we do have a great time in our car rides together. And Zirconia implants is probably something that people have been skeptical on. I understand why, because it has a learning curve. You know, there's a little bit of woo in here, a lot of crystals, a lot of burning sage and sandalwood. Hopefully I give you some useful information tonight so that you can understand zirconia implants better. I think the demand is going up. Patients are becoming a little more aware of not wanting metals in their mouth and being healthy. Definitely there's some challenges because zirconia implant so far has not been made where you can screw retain it. They're all cementable, so that adds an extra element. What, first of all, is a zirconia ceramic implant? It's made from zirconia, not zirconium, which is a metal. And it's a material that's really used in a lot of industries, you know, the aerospace industry, so it's a very strong material. It's metal-free, no potential for corrosion. It's biocompatible, the tissue heals well around it. Definitely has its aesthetic element. Sometimes you see a little dark area around a titanium implant, especially in the aesthetic area, and with the zirconia you won't get that experience. Also, with the holistic patient, this is what they want. The two systems that we use in the office are the SDS. There's two types of SDS implants. There's a one-piece, which basically the top part is the abutment and it's attached to the implant. And this is the two-piece where this part gets cemented into the actual implant. The advantage of the SDS implant is that it uses a lot for immediate implants because it has a great cutting ability and you can get it in with good stability. And then there's the Ceraroot. I especially like this type of system in a healed site, and also when I'm healing in a posterior area, it has a little more width to it, so you get a better surface area. All these implants are all preppable, so you do want to leave them a little bit above the tissue so you can have a little ferrule effect around that part of the implant. Who's a good candidate for a zirconia implant? Same thing as titanium, you have to have adequate bone, good oral hygiene. You still need to take care of your mouth. Non-smoker, smoking definitely affects everything, and patients that are looking to avoid metal, and actual patients that do have metal sensitivities, and also stuff that where a patient has a thin biotype and you're looking in the aesthetic area, they have thin tissue. So this is an example of just the healing. This is courtesy of Rashad. Thank you, Rashad. Wait a few of your slides. And you can see how nicely it heals around there. This is a two-piece, and you can see as the collar comes out of the tissue, and so that's preppable. And you'll see shortly an abutment's placed in there. You know what? I realize it's been a long night, so just take a deep breath and just like, actually I don't know if people heard about humming, how when you're stressed out, a great way to actually relax your whole nervous system is to hum. And actually the funniest thing was when I was younger, growing up, I had an older brother, about 9 years older, and we'd be hanging out, and on Sunday mornings he'd be reading a newspaper and he'd be humming. And I didn't really understand it, now I do. This is the SDS two-piece. This is looking down into the implant where you put in the abutment. That's the cover screw that's put in after the surgery. This is the actual abutment that's screwed into the two-piece. That screw's taken off, and then it's cemented in there. And so you can see that this is the part of the implant that would be up here, and this is the collar that you see over here, and there's the abutment. So this is the cementation of it, and this is a Ceraroot, and you can see how nicely it's formed around the coal area and papilla. So that's the lab case, and look how nice it goes in there. Questions that patients will actually ask: will it break? It's like made of like the type of ceramic of a mug. So really, zirconia is very tough material. It's jet engines, and it'll definitely hold up over time. Not to say that you can abuse it. You can break anything. You could break a titanium implant, the screws and all those components. Is it as good as titanium? And the osseointegration is comparable. And so for the right person, it delivers a good result. Patient says, my friend had titanium for 15 years, why change? So, titanium does work well. Ceramics do as well. Each have their benefits and limitations, but definitely for patients that are looking for biocompatibility, not having metal in their mouth, it's definitely their choice. Is it covered by my insurance? There's nothing usually excluding them. You have to check with their plan. It's just a matter of having that conversation. What do you say to a patient about these ceramic implants? So have a 10-second answer. It's metal-free, it's white, and it's a holistic option. These patients that are actually looking for this, they are usually people that do a lot of research, and they're usually very adamant about, oh, I want this, and they really know what they want. So this is just an example of a case doing the immediate atraumatic extraction, putting our bone graft around there, and how nicely it looks on the x-ray. And so with the tissue healing, we'll see pink, firm tissue. There's no swelling, no redness. The surface of the ceramic is smooth, and so it helps to resist plaque accumulation. No gray shadow that you see. I wanted to thank you all. Have a great rest of the night.